Hello, everyone, and welcome to our webinar. Tired of fluff? So are we. So here's a short story behind today's session. So recently this summer, I was on a first call with someone who said, you know, employers are tired of fluff. How are you different? And so they had a bit of skepticism in their voice. And so my response was, well, I'll pull up the data and I'll prove it to you. And then afterwards, we were talking about it, reflecting, we said, well, why not just host a webinar and answer that question for everyone? So that's what brings us to today. My name is Bill Stoyke, and I lead strategy for Launch My Health, and will be your main presenter. Joining me today, we're proud to have our special feature with Brenda Navin, our founder and CEO. And then running production is Amanda Knutson, who leads product and client experience. So here's a little teaser of where we're going today. This is just one infographic that we're going to build up to where all will be revealed. And I promise you that we're going to get there pretty quickly. So when I think about our agenda, here's what we're going to cover. Now, rest assured, you maybe saw that infographic. We're not going to go into agonizing detail about every data point. That's not what this is about. Instead, we're going to provide proof points, hit the highlights, and then share the headlines that we believe will matter most to you. And so as we go, I encourage you to please use the chat and put comments, your questions. And then tomorrow, we'll be sending out a recording with the full webinar. And then at the end, if you'd like a copy of the presentation where it's got all of this data, if you'd like that in a PDF format, including the source links that you'll see, there'll be a survey question at the end where you can enter in your email. And so with that, I'm going to turn it over to Brenda Navin to, as we like to say, get cooking. Brenda?
Thank you, Bill, and welcome everybody. And thank you for taking time out of your day to spend, the next 45 minutes with us. And as Bill said, we want to share enough level of detail to tell you about the outcomes that we're getting at Launch My Health and how we're different, but we're not going to go into this minutia of detail as well. So I want to first start by sharing a little bit about who I am and who Launch My Health is. And for me, my career started 22 years ago at the bedside. I'm a registered dietitian, and I knew pretty quickly that a traditional career path certainly wasn't going to be for me. I could see that nutrition and lifestyle was important in people's health. It was important in mine, but I could also see how disconnected they were from the healthcare system. And so throughout my career in healthcare, that 22 years, I kept challenging that, and that was exciting. I built programs, I pushed new ideas forward. They weren't always easy. I got a lot of pushback, and I really worked hard to integrate nutrition and lifestyle into healthcare. And eventually that led to leading health and well-being strategy for the organization I worked for, including clinical integration, community health and well-being initiatives, and employee health and well-being. And I absolutely loved the work and what we accomplished as a team. But I also knew there was so much more opportunity and so much more that we could actually do. And then everybody knows COVID happened. And that really put an enormous spotlight on something that we all of us already knew, that health is created long before somebody actually enters the healthcare system, or is sometimes what we call the sick care system. So in 2020, I decided I'm going to start my own company, and I stopped complaining. And for me, it was about designing the first ever scalable clinical nutrition intervention. And so today, our team, we're on a mission to bring food as medicine into the home where health is actually created. And specifically today, we're talking about outcomes and cost. That's why I think you guys are here. And for me, the most valuable lesson today is not about managing costs more efficiently. It's really about the claim that never happens. So that's what we're really talking about, is cost avoidance. And let's get started by Amanda. Can you pull up the first poll?
Absolutely. Here we go. We've got our first poll for today. Is it fluff? So, what do you think? Our most nutrition education that's available, is it just fluff? What do you think? Agree, strongly agree, disagree? Hearing from lots of you. We'd love to get the engagement here. And we're going to kind of get into the details about that coming up. All right, I'm going to end the poll and show the results. Got a nice spread there. We
A
do
nice
have some of
spread.
our clients on, Brenda, so I'm glad that there's a couple disagrees out there.
Well, and I'm glad to see that people are disagreeing too, because I think a lot of people know the value of nutrition. And it's really about figuring out what is going to be the right solution and how do we approach it. So this is the evolution, I think, of nutrition, which is exciting. Okay, so a little bit about, again, for those of you who don't know who we are, or maybe you need a little reminder, who is Launch My Health? Well, we connect what people eat and cook every day to their health, and we use that connection to address the root causes driving chronic disease. And those same conditions are often sitting underneath an organization's high cost claims. So think about metabolic health. We all know we probably have the same high cost claims, and these continue to grow and evolve. So rather than waiting for the disease to progress and costs to keep rising and rising and rising, we intervene earlier, way back. So we're getting upstream by addressing again the root causes and helping prevent progression. And this is where we avoid future costs and drive down the total cost of care. So when we look at the biggest drivers of healthcare costs, we tend to think of them as separate conditions like obesity, diabetes, cardiovascular disease. We may even have chronic disease management programs, something for autoimmune disease and gut diseases, mental health programs. But many of them share the same underlying cost drivers, which is metabolic dysfunction, chronic inflammation, gut health issues, hormone imbalance, and nutrition is again that layer that influences all of them. But we have to go deeper into nutrition and stay out of that surface level. And we see this as a clinical and financial lever that we can pull. So when you improve nutrition, you're not just helping someone eat better, you're addressing the risk way earlier before it becomes complex, before it becomes expensive. And this is what we call the rising risk population, and it's where the opportunity lies. And this is where people are not spending the time. And this is what we have to change the trajectory of both health and cost. So why now? These are just 3 individuals you see on the screen, and together they represent an estimate of $37,000 in measurable savings. So when you improve nutrition, you're not solving one problem. This is really the force multiplier, and it affects everything across multiple conditions and cost drivers at the same time. An employee working on metabolic health may improve their hypertension. Maybe they improve their cholesterol, their triglycerides, their blood sugar. They lose weight. They address their mental health and maybe even medication dependency. So better nutrition can help people get more value from the benefits that they already have and the vendors that they're already using and paying for. So we go beyond traditional recipes and tip sheets. So we're not the 5 healthy snacks or what to bring in your lunch. Our clinical nutrition is personalized, and Bill is going to show you some really cool information on how we do that and the outcomes we're getting. And we are evidence-based education delivered by experts who can help people change outcomes. So when you start looking at the savings from just these 3 individuals on the screen, imagine the impact if you have thousands of employees. And that's when you really see the opportunity. So I'm going to turn it over to Bill now to talk about our solutions.
Right. So with that excellent background that Brenda shared, here's how we start to translate it into real world solutions. First up is our digital platform. And that provides employees with, we like to call it a streaming style experience that is self-paced, and it's skills-based learning that really focuses on behavior change. And then from an HR standpoint, we make the implementation easy in a number of ways. Really, the highlight there is that there are 0 eligibility files required, and that makes it very, very easy. And then we pair our digital platform with our Launch Live monthly webinars, and these are interactive. They're hosted by our registered dietitians, our chefs, and Launch Live motivates people to take action all year long. So really all you have to do is point employees to our registration pages and we handle the rest. And then we also give you the marketing tools every month. So we really do make it easy. And then lastly, within our digital learning platform, we have a wide range of courses that span these 5 different suites. And so as we go through today, we're going to highlight courses from within chronic conditions, gut health, and our culinary suite to illustrate the sorts of outcomes and estimated future savings that we can deliver. Now, as we get started with the core of this, you can see in the photo, look at this. We do take our course design extremely seriously. But aside from that, hopefully you can already tell we're a fun group and we're passionate about what we do. And so hopefully that comes through with you. And so to really walk through it with that clinical background, I'm going to kick it back to Brenda to start going through the design.
Thanks, Bill. And this is a really, I think, important to spend the time looking at how we develop our courses and our content, because it's not just providing, like I said before, like 5 healthy snacks. This really is evidence-based. And so I want to spend just a minute on the rigor behind how we develop our courses. And this really, again, like Bill said, it comes from the clinical background in our team that we have at Launch My Health. This is where we came from. We came from healthcare. We get this. And so we start with the outcomes we want to achieve and we work backward. So that means every lesson, every video, every activity, every resource has a clear purpose that's tied to a measurable objective. And our courses are grounded in evidence-based nutrition science. So not old nutrition science from, the 1990s. We are advancing and looking at what's coming out in the current literature. And when appropriate, we always use validated assessment tools. And this means that we're using tools that have been scientifically tested to reliably, and the key word here is reliably, measure what they're designed to measure, meaning it can be duplicated. So that's why we choose them. So for example, we use the Mediterranean diet score to measure meaningful changes in dietary patterns. And we also collect pre and post course data to understand what changed, not just what someone learned, but the changes in their confidence level, their habits, and their everyday health behaviors. And then importantly, as clients, we publish our outcomes annually, and that creates accountability not only for us, but it also gives our clients visibility into whether these programs are actually making a difference. Okay, so we're going to walk through an example of one of our most popular courses at Launch My Health, which is Putting Out the Flame. This is our course that is focused on reducing inflammation, which is one of the root causes of disease. So when you look at, again, like autoimmune conditions, you look at cholesterol, you look at heart disease, we are going back to the root cause. And this is the slow simmer of inflammation in the body. So for Putting Out the Flame, these are the key behaviors we want participants to build to help reduce inflammation in their body. The important part is that we just don't tell people what to do. We teach them how to do it in real life. How to choose foods differently, how to cook differently, how to make those decisions easier and more sustainable, and it's personal to them. This is where we're connecting the dots between science of inflammation and the everyday behaviors that can actually change it. So the objectives you see on the screen show how we move participants from understanding inflammation to actually changing what they do. So they need to change something to reduce inflammation. We want them to recognize the signs. We want them to understand the nutrition strategies that can help, and then help them figure out how to apply those strategies through the foods they buy, prepare, and eat. And again, this is their choice. This is how we personalize it. We also give them guidance on the areas that can be confusing, like supplements, so they can make more informed decisions. These are things that we get questions about. And then we measure whether those behaviors are actually shifting using the Mediterranean diet score. So this is key to what we do here at Launch My Health. So about the Mediterranean diet score, this is where the rigor comes in. So we spend a lot of time identifying the right validated tool for each course, like I mentioned before. So one that's going to measure the behavior or the outcome we're trying to influence. So for putting out the flame again, that is the Mediterranean diet scores, and it measures adherence to a Mediterranean style eating pattern, which is strongly associated with lower inflammation and better chronic disease outcomes. I think it's like over 15 different chronic diseases that is in the data for the Mediterranean diet score. So research has shown that a greater adherence to this pattern can significantly reduce inflammatory markers. Again, remember, this is the purpose of the course, by as much as 30%. So for us, this gives us a credible way to measure whether participants are actually moving their dietary pattern that is linked to a meaningful health improvement. I hope you guys are staying with me here. I know this is a lot, but this is the important piece of outcomes. So with the AMED score or the alternative Mediterranean diet score, higher is better. But what we really care about is not just the actual score itself, it's whether someone moves into a higher adherence category. So that's what's telling us that the eating pattern has shifted, and that's what we see in the research. So when we look at the outcomes, we're not just asking, did the number go up? We're asking, did the participant make enough change to go into a stronger adherence category? And that means better health outcomes. That's what the data shows us. So now we're moving a little further here, and this is why the change in the score matters. Research has linked the score to improvements across 18 metabolic risk factors. So for employers, that's significant because this is where metabolic disease is not just one isolated claim. It can lead to diabetes, cardiovascular disease, obesity, other chronic conditions that become more complex and costly over time. So again, we're going back to how do we improve health outcomes? If we improve dietary patterns earlier, we have the opportunity to influence multiple areas. Okay, now we're getting even further in here, and every point matters. So we're not just looking for perfection. The research shows that even an incremental improvement is meaningful. So 1 point matters, and that's how sustainable change actually happens. One behavior, 1 point at a time. And then this brings us back to inflammation again. As I shared earlier, the higher the Mediterranean diet score or adherence to that pattern is associated with up to 30% lower levels of inflammation in the body. So we can connect the dots. If we improve the Mediterranean diet score adherence, we're moving dietary behaviors in a direction associated with lower inflammation. And then we have the questions on here. This is just a sample of what those questions look like. And again, this is a validated, standardized tool. And then lastly, we have survey questions that we're asking too. We add in this other layer beyond the Mediterranean diet score. And this is really because behavior change doesn't happen from knowledge alone. We want to know, do they understand it? Do they believe they can do it? And do they have a plan of action? Together, this gives us a full picture of whether the course is creating meaningful change. And Bill, I'm going to give a little drum roll here. I'm going to pass it over to you now.
Right, so this is where the rubber meets the road. Remember, this is no fluff, so it's time to start getting into these findings, right? We've been leading up to it. This is where we start delivering on the promise. And as you look at how we are doing this, our methodology, we're looking at a couple of courses saying what we've done is we've modeled this nationally published savings estimates for cost avoidance. And again, we'll have some source links for you at the end. And we're combining that with our participants' self-reported outcomes. And so this particular modeling that we're looking through today is for a large global client for participants January through about mid-July of this year. So just over 6 months of data. Okay, it's not even a full year, so we still have a long way to go. All right, so for the anti-inflammatory course that Brenda walked you through as an example, we're estimating about $850,000. That's the headline. And we're being realistic with this because if we run the full calc, the total potential is about 2.8 million. But we know that that's not all sustainable. So after you account for all of the weighting and the different factors, it came to about $850,000. And again, that's just after a little over 6 months. And you're probably wondering, well, how does that break down? How many people does it cover? So for this course in that time period, it's about 3,300 people, or about $850 per person on average. And as Brenda had shared with you, the course objectives and the types of survey questions that we ask, you can see that the outcomes that are reported by the employees suggest that the course is achieving its objectives from that knowledge standpoint. So we're taking those complex topics and making them easy to understand. People are having confidence in being able to identify those foods, and then they're walking away with an actual plan. And then going back to the Mediterranean diet categories that Brenda outlined, measuring the pre and post survey results, we can see that for those people who improve, just how much we're moving the needle. And so recall the importance of getting into that moderate to high or that high category. That's what we're seeing here, and these are excellent numbers. And then finally, also recall that every point matters for improvement. And so overall, for those people where this was the only course they chose to take, we saw over a 1 point average improvement. And it moved them from that low to mod into that moderate to high category. So again, not only was it a point, but we moved them into that other category. So hopefully you're starting to see this is more than well-being. It is not fluff. This is a clinical intervention. But, as we look at all of that data, there are people behind it. Data only tells part of the story. So you're going to see this as we go. In the post survey, for every course, people can optionally write comments to give us feedback. It's not required. So here's an example that is striking to illustrate the impact that this course, you'll never capture it in the data. This is talking about their son's respiratory issues. This is lifelong health and economic impact. And so, by the way, I just want to point out, as you're looking at these reviews, we didn't edit them for spelling or grammar. This is authentic. It's just how people wrote them. Brenda, maybe you can share how this resonates with you.
Yeah, and by the way, this is like the best part of my day, and I think Amanda, who's been on our team the longest, we both get these reviews in our emails, every single one, and it's a high. I mean, if you're having a bad day, this is a great way to make it a good one when you read these reviews because you're making a difference. But for the one that you see on the screen now, I think what stands out to me is that people are really connecting what they're learning to their personal health, and they're seeing an opportunity to do something different, and that's empowering, and that's what we want. We want self-efficacy, and that's again what we're seeing. And so in the first quote, one participant is thinking about prevention in their 20s. Hello, this is what we want. And then another has been struggling with chronic inflammation with a condition and came up with new information that they could apply and try something new. And that's what we're looking for. And we want people to understand, again, the connection to see what they can do differently and feel equipped to take action. Okay, Amanda, it is poll time.
All right, let me find the right poll here.
We like
All
the
about
polls.
the validated tools. It's kind of like a quiz, I guess. The concept of validated tools and their why was new to me. So have you heard of validated tools before? And why we would use them? Was that new to you? Strongly agree, neutral, disagree, strongly disagree. We're getting some answers in here. Validated tools. This is always whenever I'm talking to people, I'm like, okay, hang with me here. This is a complicated
Right. I feel like
concept.
it's complicated. Yeah.
Yes,
I
we
feel like it,
understand.
even as somebody who's clinical, it took me a while in my career to truly understand this too. So
Yes.
I'm curious what
Yes.
people
Okay, I
think.
think we're ready here. Let's see what people
Okay.
have to say. Yes, agreed. For about half the people, this was a new thing and why how they can
Right.
be useful, how you can help them make your maybe argument if you're trying to build a case for well-being with and measuring well-being. So that's awesome. Brenda,
I
anything you want
love
to
it.
add to that?
No, I just think, like the validated tool piece, as I spent my career, this again was new for me. This isn't really what I learned in college either. So we have so many different validated tools, and for us, it takes a lot of time too to evaluate what is going to be the right tool. And we've done actual real research at Launch My Health too, which I'll be sharing. But to come up with the right tools to measure it takes time and it takes expertise. So this is something that we're proud of. I'm glad that you're learning from it too, and hopefully puts you in the driver's seat in terms of being a more savvy person who can ask better questions of your solution providers too. Okay, so now we're going to get into another example. You've seen the full process with putting out the flame. I'm going to briefly, and I mean briefly, show you how we apply this to that same rigor to another course. And I'm not going to go into the minutiae detail again, just want to focus on the validated tool that we selected for this one. And again, hopefully this is going to help you as you learn more about nutrition. So we're talking about gut health here. And so for this course, we're using the MSQ, which is also called the Medical Symptom Questionnaire. And we've simplified it to focus on 9 key digestive symptoms. And it gives us a really practical way to measure whether symptoms are actually improving. And this matters for employers because about 40% of Americans, we don't have data globally, experience a functional GI disorder. So think of like irritable bowel syndrome, diverticulitis. These individuals have 3 times the absenteeism, 2 to 3 times more physician and emergency department visits. So they're costly. And so digestive symptoms aren't just uncomfortable, but they also have an impact on productivity, utilization, and cost. So again, we're connecting the dots. If we can improve nutrition behaviors and reduce symptoms, there's an opportunity to have impact on health and the costs that are associated with it. So restore gut health. The goal here is very practical. It is to help people understand what may be driving their digestive symptoms and give them the food and lifestyle strategies they can actually use. Now, people who have these types of symptoms, oftentimes they'll go to the doctor and they may get prescribed a medication, but they don't get this type of information. So we're teaching them how to identify their own triggers, make changes in their kitchen, and build habits that support better digestive health. And just like putting out the flame, we then need a meaningful way to measure whether those changes are actually making a difference. So in the course objectives, we follow that same approach. We're not just teaching people about gut health, we're looking at very specific changes using nutrition strategies. Remember, this is a clinical nutrition solution. This is not 5 healthy tips. About increasing gut supportive foods and building mindful eating practices. The goal here is to take something that can feel complex and make it very actionable. And again, it's personalized. So just like we did with the inflammation course, we pair the objectives with a validated way to measure whether the symptoms are actually improving. And again, we chose the MSQ, which is a validated tool. So Bill, I'm going to turn it over to you to go through the results on this one.
Great. So here, what's the headline? Well, we're seeing significant potential for cost avoidance here with just over $700,000 in a little over 6 months. And again, here, this is where we're combining nationally published data with the self-reported outcomes. You might guess what's coming next. Oh, look at that. We're breaking it down by person. So it's about $230 per person on average, around 3,100 course completers as part of this. And so you can see that potential for downstream savings. It far outweighs the cost of what this intervention is for an employer. And then here, based on the unique objectives that we shared for this course, employees are reporting that high confidence and they're taking specific actions as a result of what they learned. That's exactly what we want to see. And here we have our self-reported pre and post, remember MSQ, that validated tool, the results, where people are making improvements. Notably, you can see nearly half improved 4 or more points, and that is substantial. And then bringing it all together here, the average score increase was 4.5. And so that indicates the potential for real behavior change after taking the course that can be sustained. So to reinforce, as Brenda has said, it's a clinical intervention. And maybe, just maybe, you'll hear me saying that in your sleep tonight, or Brenda. So, I think, again, it's about going just beyond the data. You can see people are writing comments without ever knowing that they'll never know if we're actually reading these, but we do. And so it's powerful to see how these courses impact entire families, especially from those young ages. Brenda?
Yeah, and just to reiterate, I mean, Bill sharing these comments, people do not need to write, and this voice, alongside the data that we're getting in the surveys, collectively tells a story that makes us so proud. And this is the participant voice, and this matters. And what I see in these comments is that this top person didn't get any of this information from their physician. So we're filling a gap with that knowledge and something that they feel like they have control over improving their health. That is powerful, really powerful. And again, in this autoimmune condition here, they finally feel like they have something additional that they can work on, and talking about the depth that we're going into in this course. So to me, that's, it makes everything that I'm doing and the purpose of why we exist at Launch My Health very worthwhile. As I mentioned before, I want to just quickly share too that we have done real clinical research. And so this is a study we did on Home Chef Pro collectively as a team here. And this was a real study, a randomized controlled study in a pre-diabetic population to test whether teaching people how to cook could actually influence people's health. So participants went through an 8-week cooking intervention. It was focused on preparing whole fresh food. That's what we do in Home Chef Pro. It's about skills. While the control group received standard medical care through primary care. And the question was simple: if we give people the skills to prepare healthy food at home, can that change their health trajectory? And that's what the study was designed to do. Now the results, I mean, this does deserve a drum roll, I think. We saw improvements in body fat, blood pressure, fasting glucose, triglycerides, and cholesterol. So yes, teaching people how to cook works. And giving people the skills, I just saw a heart come up. That's great. I love that. Giving people the skills to turn nutrition recommendations into actual meals can actually improve clinical outcomes. I mean, this is simple. This is not a medication. This is cooking. And this is really relevant right now because I'm currently talking to CMS, which is the Center for Medicare and Medicaid Services. And as they're looking for ways to strengthen their diabetes prevention program, DPP. So that program has demonstrated strong outcomes for the people who complete it, but the participation and completion is really low. I used to have this was a program I used when I was in healthcare, and Amanda was part of that team too. And it was so difficult to get people to participate. So they are trying to find ways to expand access and engagement across that model. And we're really excited that this potentially could be something that gets integrated into that. Amanda, I think it is time for an audience poll again.
Yes, let's go. Last poll of the day, last opportunity. So we've got, do your well-being vendors offer you reporting on clinical outcomes and estimated cost savings? Anybody out there? What do you have? What are you getting from people? I think it's hard. It's hard to get. And and as we're explaining, as Bill and Brenda are walking through, it takes a lot of where's the engagement at? Are you able to see that end size be big enough to really drive people to engage and then make valuable change? So, all right, we're
And
ready
then
to end.
and collecting the data too. I mean,
Yeah, right.
yeah,
Yes. Okay, here we go. Kind of right there in the middle, hovering in the
yeah,
middle. Do you, don't
yeah,
you? 33% are able to get that clinical outcomes reporting. Hopefully, those are our clients who are saying that. The neither agree or disagree, right there in the middle, and then those disagree. So this is, I think that another question we could be asking too is, do you want that? Would this be valuable to you to share with your leadership team to help you make decisions?
yes,
I'm guessing
yes.
it's a yes. Yeah.
And I think, and I mean, what that tells us is right there's opportunity.
So up to this point, and I love that engagement, we've been looking at individual courses, but what does that bigger picture show when it comes to people choosing their health journey? So I think that you'll love some of the graphics that are about to come up here. So when we think about health journeys, we've defined them as somebody who completes 2 or more courses. And here's what we're seeing: 3,500 people. And they chose about 650 unique ways to reach their goals. Wow. And it reinforces that health is personal. And again, with this, we're just over 6 months into the year. So what does that journey flow look like? We're going to fill this in for you, and we'll do it really quickly. But this particular client, just as a little background, they've chosen to provide just 6 of our courses, not all of them. And so they've been a client for a number of years, and new in January was our Women's Hormones Cycle Years course. And so you can see how much interest that generated. But 77% of people started with a nutrition course because they're picking things that are most relevant to their needs. And then when you expand that picture, just look at the flow of those journeys. They're weaving between nutrition and culinary. And it truly demonstrates that health, it's not cookie cutter. It's very, very personal. And then if you look at the culinary courses, those are the green courses at the bottom. You can see how they increased over time. And people started by building their knowledge within Home Chef Pro foundations. And then they started moving into practical applications to say, how are they going to make their daily lives even easier with the specific tools and objectives of that course? So it just pairs well together. And again, nobody predetermined these journeys. People just chose them on their own because it was relevant to their needs. So just a few highlights that kind of bring that graphic into perspective and make it digestible, no pun intended. So it shows that if you have meaningful content that addresses people's needs, to us, it shows that they absolutely come back for more. And then if they keep coming back over time, such as completing 4 or more courses, that's when they're really building new skills. And then look at this, 17%. When you have that many people completing all of the offered courses, I mean, that to me says it's a remarkable achievement for that sustained behavior change and that economic impact that all of you are looking for with an intervention. And so we're wrapping up the journey section, and then we're going to get into some of these voices that we're talking about, these stories. But just recall the results of our anti-inflammatory course. You remember, we had over that 1 point improvement for people that was their first course. But you might be asking, what happens if people took other courses prior? Do you measure that? And yeah, we do. So if people took Home Chef Pro Foundations first, look at that. They started at a higher pre-course value and they finished at a higher value. And if they took both of the Home Chef Pro courses first, they started at yet the highest amount and finished still yet even higher. And ultimately, what that indicates to us is that learning is cumulative, and it should be. So that's our goal. And it's excellent to see the data bearing that out. And then lastly here, when we think about people changing their behavior and building skills over time, it should be giving employers a much greater opportunity to get that return on investment. So we're coming down the home stretch. We budgeted 45 minutes for today. We're absolutely going to do it. So we're going to finish. Those 60,000 people have told us those reviews. We're going to do it quickly. And remember, these are not edited for spelling or grammar. It's valuable information. People are not getting this in their own independent research. It helps them understand that why and how they can make changes. And again, here you won't see this larger impact in one person's results, but it is further evidence that one person's knowledge can bend that cost curve and the trajectory for entire families. Look at that, their mom and their sisters, in addition to their daughters. And again, this speaks to, in this case, cooking, taking something that maybe didn't feel approachable, but we're making it approachable and motivating and giving people the confidence to take that first step of just getting started. And so we also have a new GLP-1 course. This isn't part of our study, but it does show here how the workbooks and the tools that we give, they're actually being used as part of daily life. And it goes beyond just when you're in our platform and taking the course. We want people to take these tools into daily life. That's the change we want. And so this is the very end of it here. We took and we made a 40-second video. It's cinematic. Remember, we're not always serious. We like to have a little fun. So 40 seconds, crank up your volume. Here we go.
Every review by a real person, not just satisfaction, transformation, building confidence, helping families, empowering, daily habits, practical, different journeys, one outcome. Changing lives.
I don't know about you, but we had a lot of fun thinking about how we would present that. We wanted it to be a little bit dramatic because these are stories about people's lives, and I think that it deserves that sort of recognition. And so here we are, we're coming at the end. Here's some different sources that we're happy to provide. So again, after we're done today, we are going to be sending the full recording to the webinar tomorrow. And if you would like this PDF presentation, could be used differently than the webinar recording, just drop your name and email at that survey question at the end, and we'll be sure to get it to you. So with that, I'm going to turn it over to Amanda, which we can open up for Q&A.
Awesome. Thank you so much. We've got some questions that are coming in, so please be sure that you add them in here. We have a few minutes. So first up, how long does it take for a participant to work through the anti-inflammatory course? This was asked earlier on, so maybe just all of our courses in general. And I can take a stab at that. Our average amount of time for our nutrition courses is about 17 days. And that's with thousands of people taking them. So it really can be, within a couple of hours to a couple of months. What we've found is that a lot of people take them almost in one sitting and then retake them and go back because they want to know, what are you really trying to get me to change here? They want to know it all before then they go through it again and implement some of those changes as you go through it. Brenda or Bill, anything to add to that?
Yeah, really quick. I just wanted to add to this is really designed around the way people want to learn today. And so we know people like to stream and binge. And so that's why people have the personalized choice. They're not glued to a certain way that they have to do something or a cookie cutter way. It is really for them and how they want to learn.
This is such a perfect, I swear, these are not plants. I won't say who it is because they're just asking to the host. But can you explain more about how the courses are personalized to individuals?
I can take that. So we specifically design the courses where people are learning skills and they're given options and different ways that they can implement the changes. So they really get to choose what they want to do. And for me, I was a practicing dietitian, and the bulk of what you do as a dietitian isn't the assessment, it's the educating. And so this is how we do that at scale. And Bill's that personalized journey too really shows how people can ebb and flow throughout that, but they get to choose. So they're given all kinds of options to choose from in a downloadable workbook.
That kind of goes into the different learning strategies. So what are the tools that they get? They get the videos, the hands-on learning, recipes, workbooks.
Yes. And then soon to be, we'll have an AI companion. Sage will be in there. There's a community where people can interact with other people. So really, whatever somebody's learning style is, they can find a way, and that information can be repeatable and reinforced.
We are just over time, so wanted to ask, we've got two more questions. You've mentioned behavior change several times. Are there any certifications or anything behind behavior change and why it's important for this?
Yeah, so we're taking the science of behavior change, and we know that small changes are what's going to move the dial. People that do an overhaul in their I guess, in their health overnight and trying to follow this big overhaul does not work. So we are trying to help people make small, buildable changes throughout time and keep on adding and layering onto that. And that's exactly what we're seeing in the outcomes too. People keep coming back and they keep adding on. So we know that it's working.
And then, oh, this is a good one for us. To get a new solution, they're being asked to demonstrate an ROI. How could you show an ROI before signing with us?
I can take that one. So one of the things that we can do, and we would tailor this to you, we often get asked about this, if there's a CFO that's out there, is we can actually take your disease rate data. We have a model, and we can do an ROI estimate based on different factors about your organization, how many employees you have, expected engagement rates and completions based upon our experience combined with your data. And we're happy to run that model for you, and we can iterate on it too, based on your needs.
Another one slid through. I just want to answer this one too. Do participants have access to live support? For example, could someone contact us with clarifying questions? If so, what are those people's backgrounds and qualifications? And you kind of mentioned this, just slipped it in there, Brenda, but the community and then what type of people are experts? Could you answer that a little bit more?
Yeah, so we always have available for people, they can always send us a message. And if there is a clinical question, that would most certainly be answered by a registered dietitian, because that's all we have on our team is a registered dietitian answering, or a chef, like somebody who knows about, like you wouldn't want me answering the chef question either. If it's a business related question to like the platform, certainly anybody on our team would answer that, but it's only going to be an RD that's answering a question. So that's available. To be honest, we don't get a ton of questions that come in. We also, again, when we have Sage that launches our AI tool, that will be pulling only from our content. And so that will hopefully be able to answer any questions that people have too and help them on their path, their journey.
And then we have our community page, which is kind of like a Facebook group. It kind of feels like that. And it's moderated by our registered dietitians and chef. So depending on what question is being asked. Another cool thing is we didn't really talk too much about this, but we have monthly live webinars that are led by either a registered dietitian or a chef, where you can ask questions kind of like this and get that more clinical nutrition information. I do want to state
a ton of questions in that.
we do.
We
Want to state we only use registered dietitians. There is a big difference between nutritionists and health coaches, and even health coaches who are registered dietitians, because of how they're like what's within their scope of practice. And that's where we get into medical stuff, which we could talk about in another conversation. But the fact that we only use registered dietitians is very unique and allows us to get into those more clinical questions that people might have. Those are our questions for today. Bill, do you want to take us out, or Brenda?
What I would say is, if you have any questions, here's our contact information. Please do send us an email. We welcome that. And Amanda, if you'd like to have the final survey question in there in case folks would like to get a copy of today's presentation via email.
Thank you, everyone.
Thank you so much. Appreciate it.